Be sure to download the exam prior to coming to class on exam day. The exam is usually open for download at least an hour prior to the start of class. Be sure that you have your ID. If you're going to use a dry erase board, make sure you have that or that sheet protector. Paper cannot be used. Be sure to go back through your required readings, the different activities that you have completed up to this point, and also make sure you go back through your classroom recordings. Send an email with dates and times in the event that you think that you need to some tutoring, or if you have a question prior to the exam. Okay. So official government healthcare agencies, they're supported by tax money. Their primary service is disease prevention and health promotion. So if we can prevent a disease process, just think about it. We can prevent someone from getting pneumonia, prevent falls. If we can prevent someone from being dehydrated, just think of the amount of money that is saved. Never, and just think about how much um, hardship that is on that person. But if we can teach people to wash their hands, cover their mouth when they cough or sneeze, or during the summertime, promote, staying hydrated or getting hydrated. Just think about that can decrease the number of hospital admissions, urgent care visits, and things like that. Okay. Again, official government agencies, we do have local, state, and federal. So state funded by the state money may receive money from federal government. And then usually the states, they usually have the opportunity to accept that money from the federal government or, refuse it. If they don't want to expand whatever that healthcare service is, that state can actually refuse that money that could come from the federal government. Local health departments, they're funded by local tax money. They can be subsidized from state and federal governments. They carry out state laws, those mandated, and then they carry out health promotion. Those are those programs that are not mandated. Okay, we do have the regulatory agencies, the Centers for Medicare and Medicaid Services. They are on that value-based purchasing, which links incentives payments to hospital quality. So, you may be that quality nurse or work on that quality team where, that you keep up with the data. You go around and do surveys. You may ask questions from the patients. Did you see your nurse wash your hands? How was your stay? You can administer those surveys either one-on-one, or sometimes they can send a link and the patient can answer the survey electronically. But the payment, that reimbursement with the Centers for Medicare and Medicaid Services, they are incentive based on the quality. So it is not only important, of completing the task and skills as you should, but they've tied another piece of that satisfaction to that hospital getting reimbursed for the services that they provided. OSHA prevent work-related injuries, illnesses, and deaths. That's their primary responsibility. The Centers for Disease Control, or the CDC, they look at research, data collection, controlling, and preventing diseases. And then, we have the U.S. Food Drug Administration. They determine whether or not foods and medications and also medical devices, cosmetics, and make sure that these things are safe for us as consumers to actually use. Private healthcare agency services must be paid for. That person writes a check or swipe their card, the debit card or whatever, but those services are paid for by the person that are receiving those services. The only difference is the same care is provided. It's just that pay status. Who pays for those services? Those healthcare services received by that person. And that patient usually pays for that when it's private. Home health care, the person receives their health care in the home. We want to always be thinking about safety, that environment, and We want, and usually it has more than likely it's going to be a skill that is needed by that patient if the nurses are going in. Skilled nursing facilities, again, there's a skill that's being provided. Medically necessary care to improve health or maintain or slow decompensation. After major surgery, administer IV medications that the person have had some type of severe infection, and they're going to need more some skills completed, whether or not it's a dressing change, certain kind of medications. The person's had a stroke, they may need that therapy, and those are the different skills. So we do have hospice and palliative care. Hospice, the goal is to maintain comfort as death approaches. Now, there have been people that have been certified in using the hospice care, but then the condition improved and hospice was discontinued. But usually they're certified as saying that death is pretty much imminent. And the patient can receive hospice care in their home. They even have in the hospitals, they have a dedicated wing or building for hospice care as well. But usually there's that terminal diagnosis for hospice care. Palliative, maintain comfort. The goal is to maintain comfort at any stage in the disease process. The client does not need to be terminal. Life-saving measures can be chosen if a person is receiving palliative care. Okay, these are some other facilities where healthcare can also be provided. Wellness centers, just think about the newly diagnosed diabetic or someone that's non-compliant or they're unable to manage their diabetes or hypertension. Those wellness centers, they have those programs that they implement. They have that one-on-one that they can work with the patients and so that they can be able to manage that disease process. The adult daycare center, usually that person does not need extensive assistance. Usually this person goes there, while their family members may be at work or, they're having to run errands for that day and they'll go there. And those adult daycare centers, they do have different programs and things within that they have for their patrons or their clients while they are there. Long-term care facilities, those usually are nursing homes. We do provide that skilled care. Now, a person can require extensive assistance or setup help in a long-term care facility. Now, if a person's in a residential or assisted living facility, they should not require extensive care. And if they do, they need to be transferred to a different type setting. Because usually in those facilities, there is not 24-hour care. Usually medications are usually not administered as they would be in a long-term care facility. So community health services, best for clients in need of education, can be groups or communities. There's screening going on. The screening can be in the form of a questionnaire or survey. It can be face-to-face. They can fill out a form. It could also be, a TB skin test has been administered. We're screening to see if that person has been exposed to the tuberculin bacteria. So the role of a community health nurse, we are the advocate, caregiver, we're a case finder, we're a health planner, we're that school nurse, and we can also work in those factories and be the health nurse for those large industries. We do have Medicare and Medicaid. We know Medicare, usually those that are 65 and older, and a person with a disability, for example, someone that has end-stage renal disease. Now they can subscribe and receive, this would be their insurance, so they can get the healthcare services that they need. 65 and older, and someone that has disabilities such as end-stage renal disease. We do have the different parts of Medicare. Medicare Part A, this is in the hospital. Medicare Part B are all those services a person receives when they're outside of the hospital. And then we have Medicare Part C. This is where it's offered by a private company that contracts with Medicare. And it can include HMOs, PPOs, fee-for-service plans, and that person can also have their medications covered under Part C. But the other part that covers medications or drugs is Part D. So A is in the hospital, B is outside of the hospital. That would include like uh, ambulance rides. Medicare Part D does include prescription coverage. Medicare Part C is offered by a private company that can also offer and pay for the same services as the other parts of Medicare. Okay. Medigap assists with covering co-payments, deductibles. Medigap benefits actually fills in the gaps where the patient is not covered by another insurance. So Medicaid, usually these individuals are adults on disability under 65, and it is income based. And there is joint funding from the federal and state that helps pay for those that are subscribing to Medicaid services. CHIP, Children's Health Insurance Program, a program under Medicaid. There's free or low cost health insurance for children that are up to age 19. Because literally we talked about Medicaid being income based. So if a person makes $1, $2 over the amount that Medicaid requires, then they will not qualify for Medicaid. But then their income may not be so much so they can subscribe to that private insurance. So they have CHIP that covers the children up to 19 years old, and it is free or either low cost. So it stands in the gap as well when there's that income issue. The uninsured characteristics, lack of access to healthcare, they usually use the emergency departments for their care because think about it, if you go into the doctor's office, they're going to want that copay and they're going to want to know what insurance you have subscribed to. So usually persons that are uninsured and also underinsured that does not have enough insurance to cover what services they need, you will see them going, getting their care in the emergency department. They seek treatment late in the disease process, and usually the cost is an issue. Healthcare reform, the Affordable Care Act, it was intended to assist individuals so that they're, first of all, to eliminate the pre-existing condition penalty. Prior to the Affordable Care Act, if you had a condition, you were penalized, and your insurance company would not assist with those services and medications that needed to help you manage that disease process. In addition to that, the Affordable Care Act decreased the number of people that were uninsured because insurances were made more affordable, and they eliminated the lifetime coverage limit. So just think about it, if you have a disease process and you require a certain amount of MRIs or lab work done prior to the Affordable Care Act, once you had used whatever that amount is, that dollar amount, then all those x-rays and MRIs and whatever care that you needed thereafter, you, the person, were actually responsible for that care. Managed care, healthcare providers and insurance companies share the financial responsibility for that healthcare. Patients pay those monthly premiums. They usually use the PPOs or preferred provider organizations, and they also can include those HMOs as well. Accountable care organizations, organizations of healthcare providers that are accountable for the quality, cost, and overall care of Medicare patients, must have defined processes for promoting evidence-based medicine and reporting data to evaluate that quality again. So it's important that we establish those therapeutic relationships up front with our patients, that we are following the policies and procedures, keeping everything, making sure that we document everything. QSIN, quality and safety education for nurses. The overall goal is to prepare nursing students with the knowledge and skills, attitudes necessary to provide that continuously improve quality care. It's patient-centered. Teamwork and collaboration is the main part of it. And we're providing evidence-based care. We're just not haphazardly pulling things out. Well, we need to just do this. What evidence guides us? Is there any evidence that's guiding this this intervention that we're trying to implement? Quality improvement, use data to monitor the outcomes of care processes and use improvement methods to design and test changes to continuously improve the quality and safety of healthcare systems. And of course, we have safety. You want to minimize the harm, the risk for yourself as the nurse, and also the patients. Informatics, we're using the information and technology to communicate, manage, mitigate errors, and make sure that we support those decisions. It helps us to support the decision making that we have to do. Shared decision making based on the principles of partnership. It's partnership, the patient, all those that are on the healthcare team. It is, we support that client's autonomy in whatever decision that they make. The Institutes of Medicine, the future of nursing, remove scope of practice barriers, expand opportunities for nurses to lead, implement nurse residency programs, increase the proportion of nurses with bachelor's degrees, double the number of nurses with doctorate degrees, and ensure that nurses engage in lifelong learning. It is a lifelong process because remember, when we're trying to write a paper or we're talking about the evidence, we're going to look at the last 5 years. So we want what is up to date is to ensure that we are providing the best care that we can for our patients. Okay, so we have the SEEP, this acronym, 6 guiding aims. So it's safe, timely, effective, efficient, equitable, and then patient-centered. Okay, avoid injuries to clients from the care that is intended to help them. For example, if we're putting in a Foley catheter, it's an honor system. In the event that we break sterility, we stop. What are we supposed to do? Should we go on if we broke in sterility? Because remember, it is a sterile procedure. So we need to discard those things and start over and complete the intervention as it is sterile. Time, reduce waste, and sometimes harmful delays for both those who receive and those who give the care. Okay, effective, provide services based on scientific knowledge, that latest evidence. Efficient, we want to avoid waste of equipment, supplies. We do want to promote that spirit of inquiry because there are some things that we can do, some interventions that we can do with using less resources and time. So we do want to be efficient. We want to be equitable, providing the same care for that client, no matter what their pay status is, no matter what they look like, no matter how they're dressed. And patient-centered, we provide that individualized care. How best evidence for practice guidelines is determined? There's usually a clinical question. We use professional resources, the latest information. There's an expert or a panel of experts. The guidelines are determined. And then we use critical thinking skills. The gathered evidence is combined with clinical experience and the client's preferences and values for use in specific clinical situations. Okay. We want to plan the next cycle. So once we do complete this cycle, we want to see, are there any information? What did we learn? What can we do differently? Is there something that we can do differently? And then with that next cycle, we put those things that we learned into action. Okay. So we plan it. We actually did it. Then we analyze the information. And then can we implement a change? So PDSA, plan, do, study, and then act. But we implement with that next cycle, that information that we learned. Should this be done differently? Okay. And we do have different types of evidence. We have qualitative and quantitative. Quantity, there's going to be some type of measurement. blood pressures, even if it's an EKG reading, that's a measurement of that heart's electrical activity. It could be drawn lab work. What was the red blood cell count? But there's a quantity, a number associated with it. Finding solutions. Okay, qualitative. I did skip a slide. So qualitative, this is information that we gather through interviews. That interview can be a survey. A person completes it on paper. It could be one-on-one. It could be a group, a focus group. But it is that information gathered from that participant or that patient with that includes like their lived experiences. For example, with chronic pain, that person tells their experiences. So that is qualitative research. So there's usually develop an answerable question, that PCOT question. Formulate which stands. The P stands for population. I stands for intervention. The C stands for comparison, and then that outcome. Search the literature to uncover evidence to answer the question. Come up with this question. Look at the literature. Is there information that answers the question? Then we evaluate the evidence found, apply the evidence to the practice situation, and then we evaluate to see if did it do any good? Okay, here it is again. Okay. Patient or population, define who or what the question is about. Intervention, describe the intervention, test, or exposure that you're interested in. Comparison intervention, describe the alternate intervention. Then outcomes, define the important outcomes. Were they beneficial or were they harmful? And then time, over what period of time will this happen? Okay. And health policies, many of you probably will be on this team that assist with health policies. You have to research the literature, see what's out there, what health concerns does that facility that you're working in, do they have any health concerns? And then what does their policy say? Then what does our scope of practice say? What does the evidence say that we should be doing? And so then can lead to policy change. Okay. So health policies, we talked about the Patient Self-Determination Act requires healthcare facilities such as hospitals and nursing homes to provide patients with information related to their preferences for end-of-life care. Okay, we have the Emergency Medical Treatment and Labor Act, enacted to prevent the denial of emergency services to patients chiefly because they are uninsured and unable to pay. Because prior to this, people were being turned away. OBRA, the Omnibus Budget Reconciliation Act. Okay, several comprehensive federal budget laws passed over different years that made significant changes to Medicare, Medicaid, and other healthcare programs. Okay. Anderson policy, look at the agenda setting, the policy formulation, this policy being adopted, and then how are we going to implement? How are we going to do what this policy says to do? Then, of course, we'll always evaluate. We're going to come back and look and see the implementation, the things that we did, the interventions that we implemented. How was it? Was the goal met? Was it not met? Okay. We have the Dunn-Beans quality assurance model. Okay, look at the structure, the process, and the outcomes. We have the National Quality Forum, a not-for-profit membership-based organization focused on meaningful quality measurements. What are they look at quality, and then how are we measuring whether or not the care that was provided or what was done or the intervention that was implemented, how do we measure whether or not that intervention or the quality of it was okay or not okay? Okay, we want to maintain currency within our practice. Read widely and critically. Professionally accountable nurses keep abreast of their practice by reading journals relating to their practice. You want to join your professional organizations that's related to your specialty because they will have the latest info. They're going to be like the first line of providing that evidence-based most current information. You do want to participate in evidence-based projects, in nursing research. Okay. Again, be sure that you review your required readings for those concepts. Ensure that you go back through your classroom recordings and also look at the live exam reviews that will be provided.